Sophia Yen, CEO and co-founder of Pandia Health. Thank you guys so much for joining us on our first Facebook Talk About It Tuesday Live. Today we are talking about Asian Americans because this month is Asian American Pacific Islander Month. And so for that, if you guys don't know, me and Dr. Yen are both Asian American. So we'll be kind of talking about some information there. But before we get started with everything, make sure to use the referral code TUESTALK down below, if you guys see, to help get healthcare workers PPE during this time. So let's get into everything. Dr. Yen, thank you again. Can you kind of describe your first period experience?
Yeah, no, I think first we should have a web page. There should be a website of first periods and also stories my parents told me about birth control or lack thereof. So when I got my first period, it was dark brown. It was just a couple spots. And I was like, is this like coming out the other end? But, you know, I figured out it was coming out the right end. And for those of you who may or may not know, your period can be totally whack and weird for the first 2 years after you get them. And so that was my first period. My periods since have been 5 to 7 days, starting with dark blood, leading to bright red blood, then going back to dark blood. And I think each person is different. And it's also different whether you're on the birth control, if you're on some hormonal method. So if you're on the IUD with hormone, the implant, the shot, 75% of the people in the shot will lose their period. If you're on the pill, the patch, the ring, if you're normally a 7-day bleeder, it will take it down to a 5-day bleeder. If you're usually a 5 tampon, 5 pad woman, it will take it down to 3. It's just a lot less blood with the pill, the patch, the ring, because the whole reason that blood happens is we build that lining to catch an embryo. And then we want to make it sure it's thick and rich and can grow the embryo. And then if that doesn't happen, then blood. But if you're on the pill, the patch, the ring, you're not trying to get pregnant. So we don't build the same thickness and richness and bloodness as we would if we weren't on the pill, the patch, the ring. And so that's why there's so much less blood, so much less stuff we have to get out of our uterus and down the vagina and out into the world. And so that's why I love the pill, patch, ring.
Yeah, and I think later on we'll talk about kind of skipping your period, and if you skip your period, is all of that sloughing not going to happen? So what does that mean? But we'll definitely talk about it later. I'm just curious, did your mom ever talk to you before you got your period that you were expecting, like what to expect during your first period, or did you just get your first period and you're like, oh, is this like weird goop or something?
I don't think I ever talked to my parents at all about the periods or anything like that. How about you?
Yeah, not really. I had two sisters that actually had periods. But hold on one second. You said there's a little reverb sound. Let's see. I think that's me like echoing. So
I wonder if it's you echoing on my computer, but I don't know what to do about that.
Is that because I'm too loud?
I don't. Maybe if I turn it down on my side.
How about that? Does that sound better, Daisy? Oh,
I think that sounds better.
Okay. Well, hopefully, only when you talk. So probably the echo. Is the echo of me? Maybe if I get headphones, it might be a little better. But how about let me get some headphones, and then you can kind of talk about like what did you tell your mom when you got your period, and you were like, oh, what is this? Or maybe did you not even tell her? Did your friend kind of tell you what it meant?
So my family is don't ask, don't tell. We don't ask, don't tell about sex. We don't ask, don't tell about periods. We didn't, I don't think I brought it up to her. I don't even know how I got maxi pads or tampons. I think I had a car and I drove I certainly didn't use my mom's. I have no idea what my mom used. So I'm curious. We got a bunch of viewers on, and now Angela's back. Did you talk about it with your mom? Well, your mom's an OB-GYN, so you have a little advantage there. But also being Asian, right? Tampons, maxi pads. What were you given options?
Yeah. Oh, I'm still echoey. So while I figure out, let me pull my headphones. But I did have some. Wow, I'm way more echoey. I want to share my story before. But let me move on to the next question, and then we will go back to the period question. So, did your mom tell you about tampons or pads? And does she use the tampon is related to sex?
Yeah, so again, my family don't ask, don't tell. We never even talked about it.
Everything.
I don't think I've ever seen a tampon in my mom's bathroom. So I don't even know if she used tampons. My mom was a nurse, so she should know stuff. But I definitely see in many cultures, Asians, Latinos, and Blacks have a much lower rate of tampon use than Caucasians in my teen clinic. And I actually did a survey of college educated women, oversampling for Latinas, African Americans, and Asians, because I really wanted to pull out that Asian difference. And so it is a slightly skewed sample in that it is these women in sororities. So sorority women may be different from non-sorority women. And the difference was 66% of Latinos, Asians, and Blacks use tampons versus 83% of Caucasians. And so I tell my patients, we came to this country to become equal and take advantage of what it has to have, what it has. And if all the Caucasian people are up here, we need to achieve parity, because for anyone who hasn't used a tampon, using a tampon to me is like night and day. With the pad, I can feel the blood coming out. You know, you can always feel the cramps. You can feel it in your vagina dripping out. Whereas with the tampon, it just stops the blood where it originates. To me, that seems far more clean, you know, to just stop the blood where it originates and let it ooze and smear everywhere and all about. And definitely, I've heard the virginity issue. And I think the key there is that, one, the hymen is not a cribiform plate, meaning it's not like this, it's like this. And so you can definitely put a tampon through it without affecting the hymen. And then two, we need to define virginity as sticking something up your vagina for sexual nature, as opposed to stopping blood. And if somebody's nose was bleeding like stink, we in medicine actually put in a nasal tampon. So we put a nasal tampon. And the parents don't go, oh, don't violate the sanctity of her nose. Just let her bleed like stupid. We put up the nasal tampon if we need to. And so I think we need to get more practical and say that this has nothing to do with virginity. This is nothing sexual. This is simply the best way to contain blood. But if you go to periods optional or use the, you know, the any of the hormonal methods of contraception, it should decrease your blood overall. But if you go to periods optional, then it won't even come up.
Yeah. No, that's a good point. Am I still very echoey, by the way?
I think it's okay, but I'm not out listening on Facebook.
So for the tampon part, my mom always said that putting in the tampon just was like related to well, it's I think apparently according to Daisy, it's still a little echoey, which is okay. But I know tampons. There's like also a thing about tampon shaming. So can you kind of describe? And you actually wrote an article on tampon shaming, right? Can you kind of explain that, and then how we can kind of destigmatize tampon shaming?
So I think you mean the fact that anytime we use a menstrual product, we're kind of hiding it. Is that what you're talking about, tampon shaming? Or you meaning if you use a tampon, you're a slut?
Actually, both of those.
Okay.
Both.
Okay. So I would say, as you know, we just mentioned, there's two flavors of tampon shaming in my mind. One is just all menstrual product shaming, right? We all do the hide it in your sleeve, bring your purse, bring your backpack. I think it would be interesting. My phrase is if men bled. If men bled, they would be bragging about who used the bigger tampon, and they'd be taking their tampon and like swinging around on the way to the bathroom, like, woohoo, like bragging about it. Whereas we're like, oh, so embarrassing, blah, 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 as opposed to, I do this because I suffer for mankind. I have the ability to make babies, and because of that, I have to suck this up, So that's one form of tampon shaming. We shouldn't be embarrassed to carry our stuff. We shouldn't have to hide it. It's just a natural part of life, and people should be empathetic and thankful that we have uteri and we can make babies for this world. The other tampon shaming is the stigma that only women who've had sex can use a tampon. And even then, there shouldn't be that stigma. I mean, if we didn't have sex, none of us would exist on this planet. But also that 60% of high school seniors have had sex, not saying that that should be the number, but just saying that is the number. And that probably 95% of people that are 21 or and above have had sex. So, if you're 21 and above, there should be nothing to be ashamed of having had sex, having used a tampon because you had sex, but also knowing you can absolutely use a tampon without sex. And that's what I'm telling all the teenagers out there is that, again, if Caucasians are at 95% tampon use and we are at like 60, we have a long way to go. And we should be equal. And it's about choice. But I think once you've tried it, it'd be very rare for you to go back.
Yeah. I think for tampons, it's interesting because I just can't believe your parents never talk to you about it. So how are you going to, since you have two kids of your own, two girls also, how are you going to approach using your period? What are you going to tell them for any of our moms out there? And then maybe you could also talk about periods optional.
Yeah. So there's a great book that I like. It's called The Care and Keeping of You. It's by American Girl. In general, I don't like American Girl because they're trying to sell you a lot of expensive stuff, but they are ethnically diverse, and they have great drawings, and they know how to depict stuff, and they actually have the most graphic drawing of how to put in a tampon out of all the kind of puberty books out there. And it isn't graphic. It's in cartoon form, and it's still like this small, the images you're dealing with, but compare that to the American Medical Association has a puberty thing, and it's like, oh, tampons or maxi pads, talk to your mom. Like, This is the American Medical Association. You're not going to show people, and this is in education. We actually quizzed a 50-year-old woman the other day, so feel free to quiz anybody older than you for fun. How many holes does a woman have down there?
Is this okay? So are you going to ask me 2?
Yes.
But some people think there's 3. I don't know.
There is 3 holes. There is 3 holes.
What?
Around the corner. Right?
2, oh yes, the urethra.
Okay.
I almost thought about the clitoris. I hope I'm okay to say that online. But I know people like there's the vagina, the urethra, and the anus.
Yes, and you also should know it in order of anatomy. So you have this, right? And then the urethra is here, and then the vagina, and then around the corner is the anus. So I think of it as urethra, vagina, anus, because that's the way it goes.
Yes. This might be way TMI, but some people said that they would get the urethra confused with the vagina.
So the urethra is very, very small and thin, and where pee comes out, and pee is sterile. If pee should not have any bacteria in it. If it does, then you have a urinary tract infection, or you have asymptomatic bacteriuria, which is not normal. But actually, asymptomatic bacteria is okay, but still, most urine, if you sample it correctly, should be sterile. The vaginas can fit a penis and can eventually pop out a baby, so at least has this. It's like pinky versus this, you know what I mean? And not even pinky. It's just like a hole. And so very different in size. And then the vagina has bacteria and fungus that live in harmony. And if it gets out of whack, then you get a fungus infection or you get bacterial vaginosis. But again, the urethra is pee and it's sterile.
Yes, that's really important. Sorry, I went off tangent, but how will you also talk about periods optional?
Yeah. So first of all, check out the book, The Care and Keeping of You by American Girl. Good book for like 8 years old and plus. And then talk about the uterus and how every month it grows its lining and then waits for an embryo. And if an embryo doesn't happen, then it bleeds. And then how do you deal with the bleed? You have your option of the tampon, which stops the blood where it originates, or you can let it leak out and then get onto your panty underwear or the period underwear, or you can get it onto a maxi pad, etc. And then there's also the cup, but you have to be comfortable. First of all, I think you start with the tampon, then you move to the cup. But if you're more advanced and more comfortable with your body, you go straight to the cup and you put the cup up, and then you got to change it and deal with that as well. In terms of, you were saying how to explain it to the kids. That's how I'd explain it in a simple, easy way. How to discuss periods optional. My daughters have heard about it. I have an 8-year-old. Well, no longer 8, 10. I have a 10-year-old and a 13-year-old. The 13-year-old knows all about it, as does the 10-year-old. They've heard me talk about it. It's just biology. And as I mentioned before, anybody who's bleeding 1 week out of 4, that's your choice. We now have the technology to turn that off with hormones. And the risks are less than the benefits. The benefits outweigh the risks. So if you turn off your periods, then you have less endometrial, ovarian, and colorectal cancer. And that is a much greater decrease in risk than the slight increase in risk from breast cancer. And so the example I love, and we should repeat numbers over and over and over and over again, is that if you're on the birth control pill, your risk of breast cancer increases by 13 out of 100,000 people. So the 100,000 minus 13, which is like 999,987 people will benefit out. Not 99, it's 99987. 99,987 people will benefit for the 13 people that would get breast cancer. And then if you skip a period, then the risk increases 16.25 out of 100,000. But the comparable risk, just so you have something to compare it to, is if you drink 3 to 5 glasses of alcohol a week, that risk is 22 out of 100,000. So all of that is less than if you drink 3 to 5 glasses of alcohol a week. But it's also less risk than the decrease in ovarian, endometrial, and colorectal cancer. So we decrease those cancers far outweighs, it's a benefit than the risk of breast cancer. So it's better quality of life, and it decreases your risk of anemia, which is the number one cause of anemia in a menstruating woman is menstruation. And then the number one cause of missed school and work under the age of 25 is her periods. And that's missing school and work. That is not counting how many times have we had blood in the middle of an exam and you're like, distracted, or just in the middle of exam, you're like, blah, blah, And then just thinking that 1 out of every 4 women around you for 1 out of 4 weeks is suffering from blood. And if you're not trying to make a baby, why are you suffering?
And that kind of goes into the Asian, not to buy into stereotypes, but we always want to be the best. We always want to do well. And if we are just like stressing out on your period and then trying to study, it's just not going to be good. So thank you so much, Dr. Yen. I think it's important to talk about Asian Americans and like periods, because I had like a kind of complicated experience with my parents or my mom. She kind of was like just pads, and those are uncomfortable. And I mean, my sisters had periods, but it was like no one really talked about it still. And so
you had a whole household of women, right?
Yeah. I mean, like my sisters kind of talked about it, like take a tampon, like put it in there. And then my mom said use pads and like the fat pads, like these so uncomfortable. So learning how to skip your period is something that hopefully women, when they are starting to regulate their period, can go on to using birth control for their periods. So make sure you guys check out Periods Optional, pandiahealth.com/Pandia and search hashtag periods optional. You'll also find us all over the place. If you have any questions, feel free to DM us. But I want to say thank you again, Dr. Again. Every Tuesday, we'll be doing like a Facebook Live. And I'll be making sure my audio is hopefully a lot better next time. But thank you again, Dr. Again, and make sure to use the referral code TOOSTALK to help get healthcare workers at pandiahealth.com.
Thank you. Thank you all for tuning in, and hit us up with any questions you want, and talk periods with your mom, your friends, and everybody around you, and talk periods optional.
Okay. Thank you.
Thanks.